when most people think about nurses, few things comes to their mind, more like giving injection or perhaps assisting the doctors, which I feel like is beyond that. In today's episode, we'll be talking to you about what nurses do beyond scrub. This is Inside Healthcare Podcast, where every voice matters. My name is Sins. I am the chief host,
I'm Oluwa. I mean, not praise.
and this is Inside Healthcare Podcast. In today's episode, this is Nothing Week, and we are here to talk about what nothing do beyond wearing scrub, what they do behind the scenes. So we thought about it, and we went so far to bring a professional, someone that do this every day, and more like that is what she does. She's a nurse, a registered nurse, and we'll be introducing Nurse Daniel to you. Welcome, Nurse Daniel. Thank you very much. My name is Tim, like I said. This is Nurse Daniel. Thank you very much. My name is Nurse Daniel, and I'm a registered nurse and midwife with limited experience, and I'm happy to be here. Thank you. Thank you, Nurse Daniel. So, hi, welcome. So, to today's episode, we all know this is Nurses Week, and Nurses Week is more like it's a very big thing for nurses because yeah. So before we even go further, before we go deeper, I want us to just talk about nurses, like nurses, just nurses alone, and not nurses, not nurses. What do we even call a nurse? Let me just do that. A nurse, because most people think, oh, about encounter with a lot of people and they'll feel like, oh, nothing, I don't know, snakes, doctors, and the lines like that. And at the end of the day, for me, it doesn't really stick to. So can you just tell us what, when you talk about, when you mention a nurse, what should we expect? What are the things that should come to our mind instead of saying, oh, okay, I think it's just injections and maybe those perhaps they help solve them.
All right, thank you very much. Um, a lot of people have a wrong version about who a nurse is, and I think that because of what we've seen in movies and a lot of and some other places. Okay, so people believe, oh, from movies, let me give you an example. People believe that, oh, a nurse is just someone who follows the doctor and they say, oh, not Titi, oh, not Ngozi, and they just give instruction and the nurse will kneel down and say yes, sir. But it goes beyond that. A nurse is a professional who is qualified to actually be called a registered nurse. And he or she is a person who cares for patients, knows the reason behind the care. All right. There's something we call evidence practice, and a nurse knows the rationale behind the care given. If you just ask, oh, why are you giving paracetamol? Why are you giving this particular injection or medication? Or why are you doing it? A nurse has a scientific rationale for whatever care he or she is given. So it goes beyond, oh, just um giving injection. Nothing is even beyond giving injection. It's about care, emotional. Nothing is about emotional care. It's about psychological care. It's about physical care. It's also about the medical aspect. So it's an all-encompassing care that a person gives to a patient or someone who is in need of a care.
Mm. So it is your not there at work usually like that of the movie.
Okay, definitely not. So, all right. So, as a nurse, I have my job description. Okay, so for example, when I resume at my place of work after taking over from those who did the previous shift, I check the vital signs. I check my patients. I check what they handed over to me, the condition of the patient getting better. I check, okay, for the medication, what medication is, as this patient is there, what medication is this patient to have. For example, I work in the intensive care unit. So the patient are totally dependent on me as a nurse. So everything about the patient is in my care, so to speak. So it's not about, oh, waiting for the doctor and waiting for the doctor to tell me, oh, okay, do this, do no. I know what to do. I know what to do the moment I get to work. Do you understand? So it's way beyond just giving injections and all of that.
Now, on a subject matter of patients, so the patients actually make your work easier or harder. And for those that might probably, I would say this video, how can they make your work easier? What suggestion you can give to them to make your work easier? But firstly, they make your work easier or harder.
Okay, so it depends. People are different, and it depends on the kind of person we are dealing with. Before they became patients, they had their own personality. So they are the easygoing patient, and they're the difficult. Let me put it that way, difficult patient. But in all, we understand that um they are vulnerable states. So even if they may be proving difficult, I as a nurse, I have to understand that um they don't want to be here. So I give my best and not look at the difficult side as much as possible, even if they are trying to prove difficult and they are like, okay, for example, if I say, oh, this is your medication, I want to take your medication, or I want to check your vital time, and they're already tired because we check their vital signs, their blood pressure, temperature, pulse, and all. We check him regularly. And maybe I come to them, oh, it's time for your this is the general setting now, not in the ICU, general setting. Okay, I might come to me that they are tired. They're like, I don't want to have you nurse, you come to check my vitals already. Oh, the previous nurse already came to check and they are tired and they may be proving difficult. Or they say, oh, I don't want to take my medication, I'm tired of this medication. I, as a nurse, I understand their perspective and I try to explain to them. I calm them down, or calm him or her down, and explain the reason why. Oh, you need to take your medication, or oh, I need to actually check your vital. All right. So how can the patients make it easier for us? Okay. So I think that they should also understand that sometimes their action can make, we are humans, nurses are humans, and we have flaws. Sometimes it can make, the actions can make us react because we are humans. So they should please, patients can make it easier for us by understanding when we explain things to them and getting that understanding that we are there to help them. We want them to be better. So everything we are doing is in their best interest, and they should accept with love that we are doing what it would make them better.
Okay, so I've heard of, should I call it a stigma that nurses are like, they are good at discussing patients' matter behind, they make patients matter the topic in the hospital and all like that. So I want to say that how do you as a nurse, or okay, let me say, how do nurses manage confidential matters like, yeah.
All right. So one of the things that there's something called HIPAA compliance, and where we get to we are confidential about patients' information and all of that. And we took an oath. The moment, I think during induction or the moment you graduate, everybody takes an oath like, okay, oh, you take patients' information confidential, and also every health practitioner knows this. But when people talk about I've actually seen, I've heard patients say that, oh, those nurses were talking about me and all of that. Number one, they need to understand that during handing over, we have to talk about our patients. It's not like we are talking about them because, oh, we want to cheat. No. You as a nurse who maybe you did morning shifts, you need to pass an information across to the next set of people next set of nurses who will do the next shift. So I need to know what happened. I need to know what transpired in the morning shift. I need to know everything so that I will know how best to deal with the patient. So if a patient hears, them say, oh, maybe nurse A is telling us B who is resuming that, oh, this is what happened and all. They might think, oh, those nurses, they are just gisting or they are just, but no, it's not like that. We need to know everything that happened, in the previous sheets. So I think that's for that. And then, well, people talk, so, and people misinterpret whatever it is that they see because they don't understand. So I think that's just it.
Okay, but I feel like now you said something, people talk and they interpret or whatever. How can we make them see it in our own perspective as a nurse? Oh, okay, these people are actually talking about me because they are not, but it's not the, yeah, it's in a positive way, not like they are just, because there are some cases that even in the hospital, so they'll be like, "What patient here? That's the patient that is doing. Is it on that patient? That man, he just came now to come and treat it."
Exactly.
So what, like, how can we make them understand that, you know what, I'm telling this my fellow nurse because I need to hand over to her, and if I don't say it, it may cause a lot of things. You get so how can we make them understand that so they don't have this? I mean, I feel like if you are not in the healthcare space, you feel like they're gossiping people about it. So how can we make clear that narrative?
Okay, so one thing they taught us while we were in school is when you are in quotes talking about a patient or discussing or handing over a patient, as much as possible reduce your voice, reduce the volume, because a patient is not meant to know what you're saying about him or her to the other colleague. And that's why during handover, in an ideal setting, when we're handing over to the next nurses on duty, so in the next shift, we back the patients so that the patient does not hear um, the details of our conversation. So I think on our own part, we as nurses, we can imbibe that, and we can, ensure that whatever discussion we are having with our colleague, we are not loud about it. We are discreet as possible so that they don't have a wrong notion about what we are talking about. Then on the part of the patient, if a patient actually comes to accuse me of, oh, say I was talking about their condition and all of that, I simply explain to them so that they will understand that I'm doing this in your best interest.
Okay, so this shift of the tone, like, how do you nurses like manage it? Let's say, for example, physically, emotionally, mentally, like, is it classroom that keeps fueling you people to keep doing your bed and all like that? Money.
Oh well, I can only speak for myself. I can only speak for myself, but so those two things actually are part of this. Money is yes, but then passion is also important because if I mean nurses are underpaid in Nigeria. So if I'm after money, I'll be frustrated. Oh, because I mean I'm not being paid well for the services I render. So about the shifts and the emotional stress and all of that, I know what I'm in for. Nursing is a big deal and it can be stressful. So I already understand that this is what I'm in for. Whatever it is I'm seeing on the job, whatever it is that I'm going through, I already have that. And I keep, encouraging myself that, okay, oh, this is it, but then it can get better. After work, I try to get as much rest as I can because I know that once I resume the next day, it's a whole back to back thing. So I just have to rest well before coming to work, and during my break period I try to maximize it to rest and all of.
Have you ever had a day when you felt the need to switch profession?
Okay. So not really actually, but within the nursing profession, there people are only used to bedside nursing. I've I've had the need to think of switching to other parts of nursing, not bedside, because bedside can be very very demanding. There are other aspects of nursing that a lot of people don't know about but exist. So I've actually had the thought of, oh, I think this bedside thing might not be for me for a very long time. Towards so another profession. I think I love nursing actually.
Talking about stereotypes. So, in your opinion, what's the particular thing, one thing that people always get wrong about nurses, and you would like to debunk for them, so they don't, so they stop that particular, from that particular myth?
Okay. I think I mentioned it before. That's like which you were introducing. You said nursing people believe or people see nurses as assistants to or yes. So that's a notion it's very, very wrong. We do more than that. We are not assistants. We in fact nurses are in charge of the ward. We are ward managers. We are the ones in charge of the patients. if I if I don't want anybody to come into my ward, I'm in charge. I'm responsible for that. If I don't want, if I don't want, if a medical doctor comes, and the medical doctor will ask me, oh, I want to see this patient, and I'll be the one to give directive or direct the doctor. And if I feel like, oh, maybe could you give maybe the patient some time or something, I'm the one in charge of the ward and of the patients. Is whatever it is I say, of course, I'm being considerate, definitely, and I'm not doing it in a wicked way. I understand my duty as a nurse. So it's actually the flip side. Yes, the doctors and nurses are both colleagues, and we take care of our patients and all of that. We understand each other's job description, but not we are not nurses, we're assistants, and we don't kneel down and okay, so there's no hierarchy. You are a doctor, I am a nurse. We are both unique in our own profession.
What is superior?
For workers now, you have is it the tellers, one share, cashier, panel, I don't know, but both we are colleagues. There's no colleagues. We are all unique in our. We are all in your own space. You are your own boss. In my own space, I'm my own girl.
So like you means perspective.
Yes, and I think that's because there are a lot of, let me say, quackery in that. Yes, in this profession, a lot of auxiliary nurses. So in that space, that is what they do. They are not registered nurses.
They assist.
They don't know their job description because they are not even nurses in the first instance. They train them. They don't have the certificates. So it's whatever the person trained them, their boss. Whatever they train them to do is what they do, and they feel like okay, they actually assist. They don't know anyway. They can't go beyond. They can't go beyond. I feel like nurses, right? You have the right to question whatever a doctor writes. The normal others, oh, why are you giving this patient this medication? I think the patient's BP is high. I don't think the patient is passed. You said it in a polite manner, right? Yeah. But there are some and you are the doctor who would reason to say that. Okay, this is it. Can we just check? Can you adjust? But there are some doctors that are very, very.
Because I actually saw versions.
Yes, a collaboration. So it's a teamwork. You know your work, I know my work. You do your work, I do my work. So that is it.
So there is this school of nursing and university students. I'm talking about the terms of nursing there. So I've heard they actually have a lot of training. That's like the school of nursing than the university students. So how true is it? And I feel they are not nurses, right?
They are nurses.
The school of nursing, the nurses. Oh, I thought they have to go back to the university for.
Okay, so it's a different program on its own. So it's a different program on its own. For example, if you want to go to university, you get your degree in nursing, and you become a registered nurse, and maybe other qualifications in nursing that you want. But for school of nursing, they don't have a degree. They don't have their BNSC. They just have their nursing qualification, which is a registered nurse and maybe the registered midwife if they further. But for the 3 years, they are qualified to be a nurse. They're actually nurses. For university nursing students, they have their degree in nursing, which school of nursing students do not have, but they are both still nurses.
So the auxiliary nurses are the ones that they are being trained in an hospital.
Chill are the collegiates, chill nurses. They feel like they work in a safe space. Yes, and when you now talk about nurses week, and you feel like this nurses week for this is the I mean, sometimes they feel like, am I not a nurse too? You get, so can you help us share the light to that particular? So you are community health extension workers. I think that is for extension, I think. Yeah. So they are health professionals also, but they are not nurses. They don't. What qualifies someone to be a nurse is your your certificates. You did an exam called nursing and midwifery council exam. The CHIL don't do that. So that is what qualifies us to be a nurse, a registered nurse. They can work though the job description can be a bit similar because they are more they work more in the community. So that's why they are the community health workers. They work more in the community and they do their job description is kind of similar to what nurses, but they don't have the degree, they don't have the certificate to qualify them to be a nurse. but they are the ones you will see in the Premier Health Center sometimes. They are the ones that, they wear white and ash. For people that want to differentiate that, anyone you see wearing white and ash, it's likely a community, it's likely a chill. Oh, yeah.
So is it that the nurses are collaborated with them, just like this TBA with traditional birth kit? And so is it that the nurses have collaborated with them to be able to work in the hospital? The nurses are aware.
So they don't work in the hospital. They work in the community, particularly in the primary health center, or center rather. So the people that work, and they made this possible because of those in the grassroots, those in the yes, yes, so that they can, yes, the rural area, and even here in the urban area, but those people that may not have the opportunity to go to the higher level of healthcare. So they made it possible so that they can easily access health then, and this is done by the community health care. Okay, so I have this particular question. I mean, I hear that a lot, and when I was in school, too, it happens. So why is it that student nurses? Okay, then let me. I don't want to use my own time. Student nurses are the should I say student nurses during their internship? They get frustrated by those things. Matrons. I mean, it's for me. I said it, and you see someone come up with, "Oh, I went for this training. The matrons, they are nah. This matrons one is too much. Blah 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 blah. These nurses, they are wicked. Why? Like, is that true? Because I feel like, well, children of nowadays, let me say, they don't want to learn, right? Maybe they don't want to learn, and I feel like, well, if you really want to learn, right, you have to put everything in it. You start with whatever that comes with it. And but why is this? Why is it that way? All right. So well, thank God the older generation are retiring, and newer generations are coming up. I think gone are those days where you see, though it still happens, where you see senior colleagues bullying junior colleagues, but it's very, very rare compared to before. And I think that if that happened, they are already trying to curb that to a very large extent, and that's why you see that sometimes you see in news say that, oh, maybe during, well, because of some bullying, a nurse was sanctioned and all of that. That has really, really reduced. Many of the question is more like, why is it that whenever student nurses, whenever they go for internship or maybe clinicals, they get bullied, like it does say, I make no that is. Okay, so that doesn't happen every time, right? There's one thing I usually say. If a nurse is being mean or is acting a particular way to a junior nurse, it's about a personality, not about nurses, not about nursing. And so there are nice nurses everywhere. There are patient nurses. There are very kind people that are nurses. So it all depends on the personality of, and it's not everywhere you go to that you meet, kind of those kind of nurses that will bully you and all of that. So, but it's very, very rare now. I think that has really reduced to a very large extent because oh yes. Okay, so now let's talk behind this. Let's talk behind the scene more. In the hospital, everybody sees nurses as, how do I say it, more like one and only. Whenever anything happens in the world, oh, this bed is bad, tell the nurse. This thing is not working, tell the nurse. Nurse, the toilet's door is bad, tell the nurse. What? Like, that is, for me, that can be actually, it can be drilling actually. So, how, why is it like that? Because I'm kind of from, because you have different sections, sectors in the hospital. You have this, you have facility manager, you have this. No, so I want to pick. I want to do this and that. Is it because nurses are in charge of the ward, or because they just, it's just, I don't know. Even your colleagues, I feel like even colleagues said, or doctors, whenever, oh, but Mr. Nurse, but do this. Yes. So why is this? Why is it that? Because I feel like nurses are really trying. Because sometimes it can be, I don't know, very, very annoying and crazy. I seen time. Okay, so like I said earlier, nurses are ward managers, and they are the closest to the patients. If anything wants to happen, the first person they see is the nurse, because the nurse is always present in the ward.
and easily accessible. So that's why that happens. If anything is happening, the nurse. If there's any need, they go to the nurse. And that's why I think that in every hospital, or in every hospital, there should be everyone's job description. So even when they come to the nurse, a nurse shouldn't take it personal, because I mean, you are the person they are seeing, available. So there can be, like you said, facility manager. Okay, if a patient comes to me, I don't take it personal. I just listen to the patient's complaint and direct the patient to the right quarters, or even if I can't direct, I tell the next person that, okay, this is what is happening. This is what we need in the ward. I'm not taking it personal. Though people, it gets frustrating, and everybody's coming to the nurse. I'm in charge of the patient, not in charge of other. Exactly. So the hospitals can do their due diligence of getting a facility manager or someone in charge of other aspects of the work that people can be directed to. And I think once that happens the first time, second time, they know that, oh, this is the person in charge, and the nurse can easily say, oh, you can meet that man, or you can meet this person, and you will attend to. Then so I think seriously for
Says they want to become a nurse today. So what's an advice you give to them that before they embark on that journey becoming a nurse?
okay, I'll first ask, are you sure? Are you sure this is what you want to do? I'll ask, okay, why do you want to become a nurse? Because people go for nursing for different reasons, and eventually, once after some years, they say, I can't cope, let me just switch. So you need to be sure that this is what you really want. I would educate the person, okay, this is what nursing it can be like. Nursing can be stressful and undemanding and all of that. Sometimes you may not even have time for yourself. It can be that demanding. So, but in all, I would encourage the person to don't be under too much pressure at work. Do the best you can do, and just trust God, and hope for the best. But then rest well. Find time to rest well. Even though you have limited time for yourself, find time to rest well, and don't be under too much pressure.
Okay, so between me and you now, let's ask us, do you think the salary they pay nurses in Nigeria now can actually help young kids?
Switch words. I mean, like I said earlier, nurses are being underpaid. Like, we are really, really being underpaid. Imagine a nurse, a registered nurse, being paid about 100K.
There's some people that takes 5K.
Even less than 100. Yes. I mean, sometimes when I see such job vacancies, this is not to demean any work or any job, but imagine a driver being paid 100K, and a nurse, they are offering a nurse less than 100K. Like, what? It's nothing actually. The salary, being paid to nurses is nothing. It's not even about wealth now. Even to us today, especially in this era, it's really really bad. So I think they need to, the healthcare system. That's one thing we need to really really work on. Nurses are being underpaid. We can't even be, we can't be paid as much as the work we are doing, but at least try to appreciate us by giving us good pay. Yeah.
So the thing is it true that nurses are always of the edge? When patient comes to the hospital. But like all evidence transcribed to get shots.
Okay, so ah, the, it depends. Truthfully, we've seen scenarios like that, but it's not common. And the reason why a nurse, it doesn't happen every time. Like I said before, I'll still say that again. It depends on the personality of the person. This is a personality game, but at the same time, nurses are under pressure at work. Like, you know, like I said, a nurse is, managing 7, 10, 13 patients. Everything is on the nurse's neck. And then, maybe the nurse has already explained how to go about something before, and you still come back to ask. And the nurse has to, attend to a particular patient. Sometimes if the nurse is not careful, the nurse might just, transfer aggression and all. It doesn't happen every time, but nurses are humans too. So we are not all perfect, and yes, we can be the angels people, call us, but then they need to understand that we are also under pressure. So a nurse is attending to these patients, for example, in an outpatient department, the nurse is attending to patients coming from outside into the hospital. This person is coming, oh nurse, I need to go for the test. Where should I go to this place? Oh nurse, this is what I was given. Where should I get my medication? Everybody is coming to the nurse. Everything is on the nurse. So if at some point the nurse has an outburst, you may not blame her because she just but it shouldn't be. Nurses. Let's clap for nurses first. That's a class. We like clap. Oh, it's not best. Okay, but then it's actually nurses are more like the heart of the hospital. Let me just put it that way. Without the pass, you can't really function well, and that's a great thing. So over to you, Eniola.
Okay, thank you very much. So we have our precious dive where all our guests, they feel this information. So we'd like to see you guys too. Yes. See to they here. That is.
So this is the wrap on today's episode, and you heard from the horse's mouth, uh, already started nurse, that nursing is beyond scrub and injection that we all are familiar with. So I want us to change the narrative that comes with, oh, nurses are the makes to doctors, and it is Nurses Week. Reach out to a nurse in your life, celebrate the nurse in your life, give her one or two morning, especially morning gifs and every other thing. So yeah, that is the end of this episode. Over to you in your land.
And so, on behalf of Inside Landscape of Hosts, here, keep it. Thank you so much.
Thank you.
It's some lots of allies. Thank you so very much.
This is Inside Healthcare Podcast, where every voice matters. I still remain single and I have my amazing co-hosts, Emil
Great.
and this